Ladies and gentlemen, welcome to this week's edition of What the Health Just Happened, where we talk about all things healthcare, the good, the bad, the ups and downs, the lefts, the rights, and everything in between. We also bring on a variety of business owners, business leaders, community advocates, and nonprofits who talk about all things healthy and unhealthy in business and life. Today's guest, I would say, is a combination of both. There's definitely some healthcare in there, right?
Absolutely. Yep.
Also a business owner, community advocate. But I'm going to tell you right now, we're probably going to go off the rails based off of our conversation before we started. Kris Wilson, owner of...
Modified Independence Evaluations Incorporated.
Say that again, it's a mouthful.
Yeah, it's all the letters.
Say it again.
Modified Independence Evaluations Incorporated.
Also, I already have to say it, you have a website that drives to this.
Yes.
Callbeforemomfalls.com.
Callbeforemomfalls.com.
Okay, so this man... Little background here. I can't even read this as a lot. I'm going to give the abbreviated version. I want to hear about you. You answer this stuff. Occupational therapist for how long?
I graduated in 2008, so 15 years.
15 years. Navy veteran.
Correct. 6 years and 18 days on a submarine.
Did you say you were a astrophysicist?
No. So no, no. So I was the Homer Simpson of the submarine. I operated the nuclear reactor. My job was to keep the thing from melting down.
Oh, already going off the rails here because I love Homer Simpson. Like that's a questionable analogy, right?
The whole Homer Simpson, all of them.
You kind of look like
the guy.
Okay,
I appreciate that without the yellow head. So the guy who wrote The Simpsons actually did what I did in the Navy. He was a nuclear electronics technician in the Navy. He was on surface ships. He wasn't on submarines.
I kind of want to talk about that, not healthcare, by the way. We're not going to.
Yeah, it's not that exciting.
I got to rein it in already. Trey, we're in trouble today. Justin, this is going to be downhill quickly. Healthcare related occupational therapy.
Correct.
Right? So we talk about post-acute care previously. We've had cardiologists. We've had some home healthcare companies. What is an occupational therapist?
An occupational therapist is someone who is responsible for teaching somebody the occupation of living. The things that we do every day to get ourselves ready to go to work. So the showering, dressing, feeding, all of those things are called ADLs, or activities of daily living. The next step up, getting your laundry, getting your groceries, driving your car, things like that, those are IADLs. So that's beyond the home. And there's occupational therapists that do that. I have friends that do driving, rehab. There's occupational therapists in just about every field that you can think of that deals with what people do to either be independent at taking care of themselves or productive. I mean...
So most, I hate saying patients, we'll call them patients, people who need an occupational therapist, does it range in ages from pediatrics to geriatrics? Like who needs an occupational therapist?
Absolutely. I mean, I started in pediatrics. My first job was at a clinic up in St. Mary's, Georgia. And I started in pediatrics working with the 2 to 5 year old kids that had cerebral palsy and Down syndrome and autism. So anybody, I mean, in that case, we're teaching dexterity and hand mobility.
Dexterity
and stuff like
is a big word for these two guys over here.
That's dexterity. Dexterity is the ability to touch your fingers to your thumb, because your thumb is what provides you the ability to grasp things. Otherwise, we're just apes that are hitchhiking.
There's an ape downstairs. We're going to take a picture.
I saw a picture. I saw him down there. Yeah, he scared me when I walked in the door.
So occupational therapist. We're going to call it OT
OTs.
from here on out, right? And maybe occasionally we'll say OT means occupational therapy. Physical therapies, OT, PT sometimes go hand in hand. What's the schooling to get certified as an occupational therapist?
So occupational OT is a master's program. They do have a doctorate program now, but a master's program is really going to suffice because, I mean, at least in my opinion, OTs paint with such a broad brush that I don't think a doctorate program is really necessary, because I don't think that OTs specifically, and you know this as a nurse, I don't think that we as clinicians know what we really want to do until that first situation slaps us in the face and says, this is what you're supposed to do.
I've never heard anyone say that, and that is spot on, right? And again, any specialty or clinical educational background you go into, even doctors, right? I want to be a surgeon. And you don't know till you're slapped in the face by surgery.
Yeah.
But that's deep.
Yeah, until it hits you in the face. I mean, because I worked with kids. I worked in a clinic. I worked on tennis elbow. There's nothing more boring than fixing somebody's tennis elbow.
Is it because the patients are just mean to you?
No, I mean, you know, you take everything with a grain of salt when it comes to patients because they're dealing with something that you know, that you either can't understand or can't fathom. You know, either you can't understand the pain that they're feeling because you haven't had that pain, or you can't fathom what they're going through because you haven't been through somebody having a stroke or being a caregiver for somebody with end-stage dementia or something like that, you know?
So let's talk about getting slapped in the face, right? So you went to occupational therapy, other than maybe in college you were slapped in the face or did something wrong.
Yeah.
My wife's never slapped me in the face. Anyone been slapped in the face by a significant other?
No.
Silence. Okay. Trey's over there nodding his head yes. I'm kidding.
If it happened, I was probably in the wrong. I probably deserved it, and I was, and I probably had too much bourbon to remember it.
Oh, jeez. So Kris Wilson here, you got it's so many. We need an acronym for your business: Modified Independence
Evaluations.
I
call it MIE. It's my company.
Occupational therapist, and again, we're already all over the place, which I love. These are my favorite episodes. You got slapped in the face, I'm guessing, with the older population. How'd you transition into home health care? What were you doing? And then how'd you start this business, which I'm telling you is incredible. We're going to get to that.
I appreciate it. So actually, I got into the business by accident. I was treating patients in the clinic. And
which clinic?
I was working for a very large therapy company at a clinic down in Fleming Island.
Okay, so local to Northeast Florida.
Yeah.
Okay.
Yeah, it rhymes with rooks.
Okay, got it. No, I get it. Wink, wink, wink.
So I was working for them, and they needed me to go and fill in at St. Catherine's Labor Manor next to St. Vincent's Riverside.
Okay.
So that's a skilled nursing facility.
Which we'll call SNFs.
SNF, yep. So I'm working in a SNF, and I'm on my way home one day, and I got rear-ended very badly by a 15-year-old girl who had just gotten her learner's permit. And it injured me so badly that I couldn't physically transfer patients anymore. So they put me out on FMLA. And during that time, I had a friend of my wife reached out to her and said, hey, why doesn't Kris get into home health care? So I started with a home health agency. And from the moment that I walked in the door at my first patient's house, I knew I was exactly where I needed to be.
Okay, I got to pause there before we go into the business specifically, because I have a love and a passion for home health care, having worked in it, having had family members need it. What'd you love about it? So home health care too, like a little background, there's a couple ways to talk about this. You have an acute incident, you're admitted to a hospital coming out of a SNF, you go home, everyone wants to stay home, and you have home health care coming into the house to take care of you. What'd you love about it? Knocking on the door?
My favorite moment, literally my favorite moment was when I knocked on the door and then I heard what was going on in the home. And it immediately made me wonder, what's going on in there? What am I going to find? What am I going to walk into? What issue do I need to solve? What issue is this person dealing with? How many people are dealing with this issue? That was the best part. There was that unknown, because that's the stuff.
You have no idea what's happening before you walk in the door.
Exactly. Yeah. And that's the stuff that's unknown in the chart, because the doctors, the hospitals, the rehab facilities, none of those people have the ability to have x-ray vision and see what's going on in the home.
All of them see them in a location, facility, on site.
Clinical.
But the home environment is a different planet.
It's
not a different world, it's a different planet.
It's an absolute free-for-all.
Okay, so I like that. We're going to start knocking on the door the rest of the episode.
No, that was literally anytime anybody has ever interviewed me about, when I was trying to look for another home health job or anything like that, they always ask me what was my favorite thing. And it was always my answer.
What was your least favorite part?
I
had a gun pulled on me once. That was kind of weird.
I've had a few instances that that I still have a little bit of difficulty with. I'm not going to lie to you.
Can you tell them or no?
I had a gentleman that had wounds so bad on his leg that he had bugs crawling out of him.
Oh boy!
The crazy part of the story was that he was a truck driver and he had a Wernicke's stroke. Wernicke's aphasia is the left side of the brain, and it's what controls language. And he moved in with a roommate that he didn't know. He couldn't drive a truck anymore. And he had a problem because his roommate kept stealing his food and stealing his money. And every time he called the police, he would just call 911 and hang up the phone because he couldn't talk to the operator. When the police would show up, they'd get very frustrated. He would start cussing at them because the only words that came out were cuss words. And the police would tell him, and they would tell him, and they would tell him, and then eventually they would put him in handcuffs and put him in the car and take him downtown. So after about the third time that my patient was arrested for being belligerent to a police officer, I called JSO and I said, this is what's going on with this guy. Please stop arresting this guy. The problem is that his roommate is taking his money and taking his food. And by the way, the maggots crawling out of the wounds in his leg is probably not a good thing either.
So look, I lived in this world. I think you two are probably like, oh my gosh, this is weird, but I
had to go to mental health I had to go to
that
counseling.
One wrecked you.
Yeah.
I've got, again, anyone who works in home health care, first responders, I have very similar stories that kind of wrecked me.
Yeah. It's hard. If you're in the hospital and somebody's having a bad time, at least you know they're in the place that they need to be in to get the help that they need. But when you're in the home and you know that sending them back to the hospital isn't going to help them, that's a really hard part. It's a really hard part, man.
Dude, right off the bat, we went that way. I didn't expect to go that way.
You got me all verklempt over here. Jeez.
That hit hard.
Yeah.
That's an example. I have a couple. I'm thinking of immediately going back to stories, but to me, you care, right? You
very much so.
You give I don't think we can curse on the radio, but which drove you to start this business.
Absolutely.
And what you're doing, which is, it's unique to me. Mm-hmm. So I need to also mention how we met. My wife, your wife has done.
My wife's a professional makeup artist.
For 25 years.
At least, yeah.
Local to Jacksonville.
Yes, sir.
And my wife went and got her makeup done for, I don't even know what it was for.
Yeah.
She comes home, you got to meet my makeup, what's your wife's name?
Carrie.
Carrie's husband does this. I started looking at your social media, and I'm like, this guy's hysterical. He works in the space I'm familiar with. So all of that.
And then you and I had like an hour and a half long phone call.
Yeah, first conversation was solid.
I've never talked to anybody that long.
That's not true.
The first time I talked to him?
Was it that long?
It was an hour and a half.
Oh, dang, man. I got to look back on that.
It was crazy.
Yeah, it was destiny. Anyways. So again, you're compassionate and passionate, right? You I'm guessing work your butt off because it's a grind to be an occupational therapist, especially in the home.
Absolutely.
So you started this company
4 years ago.
4 years ago.
Yep.
Right before COVID?
Right before COVID.
Yeah. Great timing to start a business.
Yeah. If I'd have known that Voldemort was going to.
That's what I love that he called it that. That's what we call it. If you haven't read the Harry Potter books, that's what I call COVID is Voldemort because we don't like saying COVID.
He should not be named.
Yeah.
If I'd have known, I probably still would have done the same thing, honestly, because what I do is so unique and so vital to people being able to remain in their homes that I don't think I would have done anything different. I got a lot of experience during COVID working in a field that I never expected to get into, which was marketing for a hospital. I did get the experience that I needed because I was still kind of rough around the edges as a sailor.
You're very clean around the edges.
Well, I appreciate it. But I needed to learn how to talk to people and stuff like that. I mean, I can talk to patients, but I needed to be able to talk to doctors and hospitals and health insurance and stuff like that. So it was a valuable 2 years, even though I got stuck in a disadvantageous position. And then in January of 22, I decided that I'm done working for anybody else.
I love that. I wrote something down here. I love a sentence specifically here. I thoroughly enjoy helping people solve what I have frequently seen as a $10,000 problem with a $100 solution.
Absolutely.
Right? Sometimes money talks.
Yep.
In the home environment, who has what funds? How are things getting paid for? What does the business do? This is why I like this, because I'm 40. I have my parents. I recently lost all my grandparents going through these situations because they're just dealing with it. My parents will be there. Then you have kids. Anyone between the ages of 35 and 75 need to understand what you're doing, what's available, what's out there.
Absolutely. That's the sandwich generation, right? Still raising kids, and you got parents in their home that you're trying to figure out how to get them to a doctor's appointment, how to get them their medication, how to keep them off the floor, how to keep them entertained, how to keep them from going stir crazy when they can't leave the house anymore. Yeah. So, I mean, our group, I'm 47. I'm dealing with the same thing. I got a 24-year-old kid and I got 70-something-year-old parents and in-laws, and my parents, will listen to the occupational therapist who comes to their home.
But not you.
But not me, right? My in-laws, they understand where I'm coming from, but here's the thing. You put a seatbelt on before you drove in here today, right?
Of course, yeah.
Okay. And you put the seatbelt on not because you planned on speeding to get here or drinking and driving or playing the music too loud or driving on the wrong side of the road. You put your seatbelt on because you don't know what's going to happen. Somebody not paying attention could run into you, and that seatbelt is supposed to restrain you and protect you from an injury, right?
Correct.
So I get asked all the time, when's the best time to worry about falls? Well, the best time to worry about falls is at the same time as you're trying to figure out what you're going to do after you retire. Because the last thing you want to do is work your entire life for somebody and then fall like I had a client do 6 months ago. 2 days after he retired, he's coming out of the grocery store, tripped over a yellow parking bumper that wasn't painted yellow.
That's a big one.
Hit his face off the ground and suffered a traumatic brain injury. And now he and his wife's plans to travel the world are shot.
Man, you got a couple depressing stories. This is the real world. Yeah, this is real life.
Yeah,
right?
it should be less depressing knowing that there's people out there who can help with situations like that. I had the pleasure of helping these people. He was stuck in a rehab. They wouldn't send him home until his home was outfitted properly. Their house was above grade, meaning it wasn't sitting on the ground. So they were trying to figure out how to get a ramp to the part of the house that they needed to get to and stuff like that. So it can be depressing if you think about it.
It's not,
but it is. But it is a little bit because nobody wants to think about getting older, right? And nobody wants to think about that lady who's laying on the floor for 16 hours without her medic alert button, right?
Remember those old commercials?
Yeah, help, I've fallen and I can't get up, right? But here's my thing. There's no sense in worrying about the person that's on the floor because what should have been done was prevent the fall in the first place.
I'm going to not butcher this, but give my description to whoever hears this, right? When you hit a certain age, you are more prevalent to fall.
Why do you think that is?
Lack of strength, medications, vitamin deficiencies, lack of education, fall risks in the house. I mean, there's a gamut of reasons, I would say. Mm-hmm. Do you have a specific one you want to say?
So I agree with medications.
Huge one. Polypharmacy.
Medications. In my opinion, most people end up living in their forever home for 30 or 40 years. So the obstacle that they've always walked around, the ottoman that's always in the way or whatever, is now an obstacle that they can't negotiate. In my opinion, as the stepfather to a child with low vision, being able to see what your obstacles are is probably the biggest way to prevent falls. And what happens is, as we get older, we develop cataracts. Those cataracts don't let as much light in. We still have the same 40-watt bulbs that have been in that light fixture for 20 years, right? Because we don't want it to be too bright. But we just don't have enough light to be able to see.
These are all examples. The point I'm getting to also is like what your business does, what you're doing.
Yeah.
Again, I want you to talk about this, not me. This is
you're fine.
Abbreviated, butchered version.
Yeah.
You are going into homes to do, I would say, very, not complex, but in-depth assessments of a house to say, this is not safe, this is safe.
Right.
Let's change this. That looks good.
Yep.
You need this, not that.
Yep.
Like, again, I'm really simplifying this.
Yeah, so the reason I started my company was because, first of all, I had an opportunity to work with the state of Florida through the Brain and Spinal Cord Injury Program. For anybody that doesn't know, anybody who suffers a brain injury or a spinal cord injury in the state of Florida automatically qualifies for a $20,000 grant to modify their home and make it safer.
Say that again.
The Brain and Spinal Cord Injury Program in the state of Florida has a $20,000 grant for anybody who has a brain injury or a spinal cord injury in the state of Florida. They just have to be the payer of last resort. So if you're in a car accident, obviously you're going to lawyer up and they're going to get paid, right? But if people don't have insurance, I mean, I had a guy that broke his neck falling and he didn't have insurance. So we were able to use a grant to help, fix his home up so that his powered wheelchair would get around and everything like that. So the reason I started my company was because I knew exactly which shower chair I wanted my patient to use when I looked at their bathroom and I saw the way that they moved. And then I would work with them and show them how to bathe themselves, how to get in and out of the tub and everything like that, and then discharge them. And then some time period later, usually 6 weeks to 6 months later, they would fall and another home health agency would go in, another person with an opinion. And you know what they say about opinions, right?
Where's Justin? He's not here. They're all like bee poles and they all stink.
Yeah,
yes,
exactly.
agreed.
Right. Yeah. So that was my problem. I was following around these therapists that didn't, at the same time as I have all of this experience doing these complex setups for people with huge powered wheelchairs and overhead lifts and everything like that. And I've got inexperienced therapists in home care telling my patient that they need a different shower chair. So what happens is 6 months later, when they fall again, I go back into the home because they forgot that they didn't like the agency that they had before. So they'd hire the agency back that I worked for. I go back out to the house and the shower chair that I recommended is in a bedroom stacked on top of all the other medical equipment that somebody else told them that they needed to purchase. These people are on a fixed income and they're going to Walgreens and buying shower chairs. And at the time, you have to realize at the time that I was doing this, Amazon was not nearly as prevalent as it is now.
Man, I know
so
this
people
world
would
so
literally
well.
forego the use of a shower chair because they couldn't figure out which shower chair they needed because they had people, I mean, literally therapists in the rehab facility would be like, you need a shower chair. Which shower chair do I need? Oh, you need this one. That therapist never stepped foot in that patient's house. They have no idea what their shower looks like.
So there's a couple things going on in my head. One, you are very passionate about shower chairs.
I love shower chairs. I have 3 of them in the shower. No, I'm joking.
Here we go.
I'm joking. But we did travel. My wife had a broken foot and we traveled with a folding shower chair. There's nothing like going through customs in Toronto with a folding shower chair in
How
your
many
suitcase.
shower chairs are there?
There's a lot of different kinds.
Clearly.
Yeah.
What makes a difference here, too?
I got a question for
here
you.
we go,
Is
Tracy.
it so important to you because most falls happen in the shower?
No, actually, more falls happen in the bedroom than in the bathroom.
What?
Yeah. But I mean, think about how many times you get up in the middle of the night to go to the bathroom. You lived in your house for how long? When's the last time you turned a light
Now
on?
that I'm 40, at least.
good point.
Yeah.
Right? So these people live in the same house. They know exactly where all their steps are and everything like that. They don't turn a light on. They stumble into the bathroom. I got guys with prostate problems that are standing up, swaying back and forth all over the toilet, right? Or women that are sitting down on the toilet and the toilet's not the right height and they can't get up. So honestly, more people fall in the bedroom because they're getting out of bed, their legs aren't ready, their blood pressure medication kicked in, that pain pill that they took at 8 o'clock finally kicked in at 2 o'clock in the morning. They're on a diuretic, which means that they can't hold it. They're peeing themselves all the way to the bathroom.
I told you the time would fly by, right?
Yeah.
We're barely scratching the surface of the
Okay.
business. And then we got to have some fun on the back end, too.
Yeah. So I started my business because I realized that people were wasting money on things that were inconsequential. The most important thing you can do to your home is provide adequate lighting. If you see an obstacle, you can avoid an obstacle. You don't drive in the dark with your headlights off, right?
I hope not, yeah.
Right? So I started my company because I have professional expertise. I'm certified as a certified environmental access consultant, which is a bunch of big words.
I highlighted that here.
Yeah,
Certified
yeah.
Environmental Access Consultant.
Yeah, insane, right? I am an occupational therapist who is an expert in the field of home safety assessments. So what I do
That's
is
good right there. Say that again.
I am an occupational therapist who is an expert in the field as a certified home safety consultant.
Which is necessary.
Absolutely.
Like more necessary than people realize. Okay. Kris Wilson, I got it. What's that again? Certified Environmental Access Consultant. I just like saying that.
You
It's a
just
lot
said
of
it.
words.
Yeah, I don't even like saying it.
I don't either.
I'm glad you enjoyed
Doesn't
it.
matter. Modified independent evaluations. Coming up on the commercial break here. If you're catching this on the radio, if you hear it on the podcast, there is no commercial. But Kris Wilson, so far so good, right?
Absolutely.
Question mark? We
No,
might have some jokes in the
exclamation
back
point.
half. Exclamation point.
Yeah,
we
no
were talking about
question marks.
texting earlier, and like when he voiced a text, Kris Wilson, that's what the health just happened. All right, welcome back to the second half of What the Health Just Happened. We have Kris Wilson. Welcome back.
Welcome.
Tell me all the acronyms you know. Just kidding. The name of the company, tell me for real.
The name of my company
Yes,
is
your
Modified Independence Evaluations.
Modified Independence Evaluations.
Correct.
Occupational therapist, been doing it for a long time, does in-home assessments. If you missed the first half, it's available on all those podcast platforms. I don't know, Apple, Spotify.
It's your
iHeartRadio.
program. I don't know where you're at.
Yeah, I don't. My wife does this. So Adrian Jensen, thank you. If you missed the first half, we talked a lot about shower chairs. That was kind of comical, I thought.
I heart shower chairs.
I heart shower chairs. That's a good podcast station right there. Obviously, the business, your history, a lot of one difficult story too, but that was the first half was a blast.
Yeah, absolutely.
I think we go into healthy or not healthy.
Do it.
Did you think of any?
No.
Okay. Healthy or not healthy? A patient discharging home communication-wise from facility to home health care.
Not healthy.
Okay. Healthy or not healthy? A home health care agency doing an in-home assessment for safety purposes.
If they're the only resource that's available at that time, then something is better than nothing. Essentially, if a home health therapist is working with a patient and they feel like they need something, they would be like a Cadillac. If I think they need something, I'm more like a Ferrari.
So we'll say probably healthy and unhealthy, depending on who walks in that house. But call the Ferrari.
Yeah, I would. Yeah, depending on the person that walks in the house. For the most part, I'd say it's healthy.
Healthy or not healthy? Homer Simpson.
Not healthy.
Oh man, I was going to say healthy.
Too many donuts, bro.
Too many donuts.
Yeah.
Okay, healthy or not healthy? Arguably the most addictive drug in the world, golf.
It's extremely healthy.
Healthy?
It keeps me off the couch.
It's not healthy for me.
Although every time I make a birdie, I do a shot of Fireball, so maybe it's not healthy.
I love this guy more and more. Healthy or not healthy? The Pittsburgh Steelers fans.
Pittsburgh Steelers fans are very not healthy because we ate too many Roethlisbergers for years.
Okay.
Did you ever see those things? They're like this big.
Yes, I try to make one at the house. I'm telling you,
a lot of
you want to
cholesterol.
think of real quick.
Yeah.
Any healthy or not healthy? This is always the funniest thing.
Healthy or not healthy?
The number of shower chairs available for sale.
It's very healthy.
Really?
And people need to use them.
Okay. Healthy or unhealthy adult diapers?
Not healthy because they cause urinary tract infections.
Okay.
So how about this?
Go ahead.
Healthy or not healthy, a healthcare provider that knows that a patient is a fall risk but doesn't use a gait belt because they think that they have cat-like reflexes.
It's a slam. Unhealthy.
Right.
Or I'm strong enough I can do this.
Right.
By the way, I never used a gait belt.
So do you think that stops at people with 2-letter designations after their name, or do you think that goes even higher up to the MDs and stuff like that?
No. Again, I would say I'm pretty fit. I never wore a gait belt my entire life.
Yeah.
Which is dumb. Fire department, ER, etc.
Yeah. The number one way to prevent falls is a caregiver with a gait belt around a patient who is a fall risk. That is a number one
home
way.
environment for sure.
Number one way. I don't care where they are.
Yeah.
I'm be in the middle of Winn-Dixie. If you're a fall risk, I'm going to have a gait belt on you if you want to walk.
Are you wearing a gait belt right now?
No. But I have a box of them in my car. I bought a ton of them.
Brought those. You need sponsored gait belts, dude.
No, I bought a ton of them during Amazon Prime days and put my name on them.
All right, Kris Wilson, Modified Independence Evaluations, goes into the home environment, does these home evaluations for fall risks, which I got some crazy stats here. Before we go into the business side, anyone you want to give a shout out to?
Well, I want to thank you for having me on the show, first of all.
Okay, cut that part out. That's awkward for me. Continue. I'm kidding.
I want to thank my wife for doing your wife's makeup and having the nerve to talk to you about me. No, I mean, not anybody specific,
Okay.
you know, I mean,
Okay.
Yeah.
We like that too. So let's go to the business here.
Yeah.
Insurance is a big part. We want to talk about that. How are these services paid for?
Correct.
So a typical in-home assessment, you are getting referred patients. Well, sometimes patients is not as personal, but let's call them patients in this instance. Workers' comp, brain and spinal injuries.
Right.
How are you getting these inbound people that say, I need this service?
So when it comes to brain and spinal, the state of Florida contacts me directly through the Department of Health. Workers' comp, I am in network with the major TPAs, the third-party administrators. Yep. So during COVID, I was doing virtual assessments all over the country. So they'd pull me up on FaceTime, have a contractor there. The patient would be there. I'd do an assessment on them, and then the contractor would walk around with me, and we'd measure things. As far as insurance assessments are concerned, then we get those referrals from doctors' offices. But I'll tell you what I really
Tell
want...
me what. I love this guy,
What I really want. Listen, man, the number one place where all these people reside who are falling is in the hospitals and the rehab facilities. Right now, the process is that somebody falls at home, the chuck wagon picks them up, takes them to the hospital.
That's an ambulance, by the way.
There you
I
go.
love saying that. The chuck wagon.
The hospital puts a Band-Aid on them and then sends them to rehab. The rehab, for years, this has been the method. They send them home with home health care. And during that time, the home health care has about 48 hours to get out to the patient. Well, that's 48 hours
that's
that we have.
A 2-day gap.
Right. We have a 48-hour gap where this person is still a fall risk. The family's overwhelmed, dealing with a new medical condition, and they're at their greatest risk of falling. So the number one place that I want referrals from is I want referrals from hospitals and rehab facilities, because my company can go in, we do an assessment, we bill the insurance, we do an evaluation, assessment, and discharge in the same day.
This is the day they're leaving.
The day that they're leaving, right?
Okay.
So the day they leave the hospital, we get the order. As long as they're in the home, then we can bill the insurance. If they're not home, then they don't exist and the insurance is null, right? But if they discharge home and we have an order from a rehab facility, we get in there and tell them what they need to do. I don't know the last time you checked, but if you look on Amazon, you can literally get stuff tomorrow. If you order enough stuff, you can get it by midnight tonight. So if we can get in there and do an assessment, they can know everything that needs to be done so that the occupational therapist who's coming into their home from an agency actually has a shower chair to work with to show them how to use it.
So many points to hit. I just want to say one thing. What is the highest readmission? So when you come out of a hospital or a SNF, skilled nursing facility, what is the highest readmission time frame?
It's the first 72 hours.
Within the first 72 hours. So there's a chance, which is pretty frequent, that no one's coming into your home for 48 hours. So all you hospitals, skilled nursing facilities that are getting hammered for readmission rates by Medicare, get a gentleman like this to come into the house, do this assessment. That will increase the chances of decreasing a readmission.
I love that.
That's hard to say.
A positive with a negative.
Yeah, that is.
Yeah.
It's not a double negative, though.
No. So it worked out to zero. What's the number one day that hospitals and rehab facilities discharge patients?
I used to don't just tell me.
It's Friday.
Before the week.
Yeah, right, because the hospitalists don't want to come in and make rounds on Saturday, right? So we're discharging Mary home on Friday.
They come in Thursday. They need to probably stay through Saturday. It's like, nope, send them home.
Send them home. So they discharge them home on Friday. The agency receives the fax at the end of the day on Friday. Not my agency, but one of the home health agencies. They receive the fax on Friday, and they don't have a nurse to staff until they show up on Monday. Those are 3 critical days that person is home, and that's a great opportunity for a company like mine, or my company, because since there isn't many companies like mine.
I don't know any companies like yours, if I'm being honest.
There are other therapists who do assessments. Personally, I don't have any conflicts of interest, so I'm not affiliated with a contractor. I don't do any of the work or anything like that. I look at myself kind of like if you went to a mechanic that owned a parts store, there's a pretty good chance that a lot of the parts that are in the parts store are going to end up in your car no matter what's broken.
Yeah,
right?
That's okay.
In my case, I have no conflicts of interest.
You've got great metaphors. Has anyone told you that? Like, I'm not saying you have great legs. You have great metaphors.
Well, hey, I appreciate it. I'll take a compliment anywhere I can get it. So that's. I lost my train of thought.
The parts in the store, but again,
it's so if you don't have a conflict of interest and my only purpose is to go in and help people understand what needs to be done to prevent the life-changing fall. And the problem is that I don't meet them before the first fall. The first fall is the most critical fall because the first fall is what earns them a walker or a wheelchair. The first fall is what makes everybody wonder if mom needs to go to a nursing home. The first fall is the one that we have to prevent because the first fall is the one that changes the patient and it changes their family.
Can I read some stats? I like to bring stats specifically. Falls among adults ages 65 and older are very costly. That's the first thing it says, right? And that's probably who you work with the most is 65 and older.
Absolutely.
Okay.
Yeah.
Do you know how much it costs per year in dollars in the United States?
No.
$50 billion. To the medical system.
A lot of cheese.
It falls, right?
There's a lot of people making money if that's $50 billion.
Well, so a lot of them are avoidable in the first place. So you want to save costs in healthcare. That's a big thing for me. Avoid falls to begin with.
Right.
That's what your services do. $29 billion per year is paid by Medicare. This is annually.
Yeah.
$12 billion is paid by private or out-of-pocket payers, I think you want to talk about. And $9 billion is paid by Medicaid.
Yeah.
That's a lot of dollars.
And all falls are preventable. Every single fall is preventable.
I wouldn't say every single one of them. I might challenge you on that.
Okay, when's the last time you fell?
On the way in here,
And what were you doing?
my shoes were untied and I had half a bottle of bourbon. Neither
My friend, all falls are preventable in a case like that, right?
Mine is probably based off of age and comorbidities, medications taken, recent hip replacement. I mean, I guess what's your point? You think all falls are preventable?
I believe that all falls are preventable. If you do everything.
What about a 1-year-old learning to walk?
So listen, a 1-year-old is supposed to fall down because that's how they learn how to balance themselves.
I agree.
The opposite happens as we go through childhood development, and then we get to senior, adulthood, and then senior age. The problem is that fall that a baby would have sustained that taught them balance, that fall in a senior now regresses their balance. It regresses their confidence. We see an opposite effect when people who are in an older age group start falling. So that's why I say that all falls are preventable, because I'm not trying to get into your healthcare business, right? But when's the last time?
Come on in. I love when they do that. Come on, get on the show.
So when's the last time you went to the pharmacy and picked up a medication, a prescription?
I'd rather not admit, but 2 weeks ago.
Okay.
Yeah.
And I'm certain they did their diligence and asked you if you had any questions for the pharmacist.
Yeah, every time.
Okay. So did you have any questions for the pharmacist?
No, I know the medication.
Okay. All right. So now seniors that get their medications changed all the time, pharmacist is just salivating to answer their questions, because the last thing they want to do is be in the back reading prescriptions and counting pills, right? So
we're going to go down a rabbit hole here.
When it comes to medications, the simplest thing for anybody to do is ask critical questions. What is this medication going to do to me? By the way, this is my list of medications. I already showed it to the doctor twice, and he already told me he was going to prescribe this to me. But just one more time, why don't you put your pharmacist eyes on this and make sure that it works for me?
So all falls are preventable.
All of them.
I still want to go back because we got to hit these.
Do it.
We're running out of time to the payment methods, insurance specifically. But what are the, let's say, top 3 reasons your clients fall?
I would say medications.
New medication or polypharmacy?
Polypharmacy, you can get a prescription and then go to another pharmacy and buy something else. So medication, lighting, and obstacles in the home environment. I do not believe that strengthening a patient prevents falls.
Wow.
Listen.
You'll butt heads with a lot of PTs out there.
Hey,
I like this.
Bring it.
Let's get a PT for this topic.
You see me on camera? Bring it.
This is your camera over
Bring
here.
Bring it.
You hear that? We need a physical therapist in here. I'm just going to sit between you two and you go
listen,
at it.
I'm going to explain to you why. All right? Everything in healthcare is based on research, right?
Yeah.
If it wasn't based on research, we'd still be doing bloodletting every time somebody got sick, right? Or putting leeches on our skin.
That's fair to say.
So the CDC just released a compendium in July of this year. A compendium is a 5-year study understanding the 4 main components that Medicare is concerned with: falls, rehospitalizations, hospital-acquired infections, and medication mistakes. All right?
Why do you think Medicare focuses on those 4?
Because those are the 4 main reasons that people go to the hospital.
Because it's cost them the most money.
It costs the most money,
by the way.
right?
I don't want to talk about that. But.
So the compendium found that the least effective way to prevent falls was to rely on a patient going to their primary care physician and telling them that they were afraid they were going to fall. That only yielded a 10% decrease in falls over a 5-year period. The next most effective thing was physical therapy. Not physical therapy specifically. I should probably retract that. Strengthening for balance. Okay? That was only 27% effective. The next most effective was talking to your pharmacist about medications. Having your medications reconciled was 34% effective in reducing falls.
First off, you need to send me this article so we can tag it to.
Absolutely.
Absolutely. Again, the more we do this show, it's
I love showing it to doctors.
That's great. Okay.
So the most effective way to prevent falls was a home assessment from a certified occupational therapist. That reduced falls 61% in the home.
Environments.
Exactly.
Which you go back to lighting, carpets, ottomans.
Right.
Getting in and out
Dogs,
of the shower.
Cats.
Young grandchildren?
Grandchildren, they don't know that grandma doesn't have good balance. They're pulling on her dress or they're walking in front of her walker or whatever. All falls are preventable.
Okay.
I'm going to keep saying that.
All falls are preventable. I'll buy into that.
And the best way to prevent falls in lieu of anything else is a trained caregiver with a gait belt on a person who is at risk for a fall.
I think branded gait belts, that's might have to happen, by the way.
Yeah, a little bit.
Just
a little Aaron Rodgers action, right?
This guy. All right,
so the 61% is the field that I work in. I'm a certified environmental access consultant who is an occupational therapist.
Certified environmental access consultant.
Yeah, it's that. Yeah, it's like a trash engineer or whatever they call them.
I love the business side as much as the healthcare side.
Yeah.
Right. In fact, at this point, I'm probably going more in the business direction. So how are you compensated? You have to how are you funded? Insurance. How is it getting reimbursed by insurance company? Is it Medicare? Is it Medicaid? Private pay?
So the only insurance that we're not in network with is Medicaid.
Okay.
It's because Medicaid doesn't have the funding to pay for such things.
Yep.
You know, they're really like a Band-Aid on a broken bone.
Yeah.
Right?
On a gunshot wound.
Right,
yeah.
exactly. But my company can bill all the major insurances. We can get authorization. We get an order from the doctor, a referral from the doctor.
The discharging doctor from...
No. I mean, a primary care physician. You know, the thing is on Medicare, patients they go back to their doctor every 6 months.
Yep.
So every 6 months, the doctors have an opportunity to ask the patients, have they fallen? As soon as they say that they've fallen, what used to happen was that they would order home health care or they would order a referral to go to outpatient therapy to work on one of the least effective ways of preventing falls.
What about near falls? That's the thing too. Like, do patients admit, hey, yeah, you didn't fall in the last 6 months, but you almost fell 5 times?
Yeah, I mean, I don't get into splitting hairs because a fall is an unintended descent to a lower level.
Okay.
So you can fall onto a chair, you can fall onto a toilet.
This is for doctors to hear, like who aren't referring your services that can dramatically decrease hospital admissions. Mm-hmm. You say that definition, and I like that.
So the best way to prevent rehospitalizations is to decrease falls by telling your doctor.
What was the definition of a fall you just said?
A fall is an unintended descent to a lower level.
So we're on a mic here, but that's a fall.
That's a fall.
And that's what I think people need to understand. You don't hit the ground and bust your nose or get a traumatic brain injury.
You don't have to have an injury. The problem is that we look for a boo-boo, we look for a bruise, we look for a broken bone, we look for broken skin, we look for a concussion. But the
treatment, not prevention.
Right, but the most dangerous thing is that person whose ego has now been injured because now they don't have the strength to resist the most basic thing, which is resisting gravity and holding yourself up. Period.
Gravity's a son of a... Can I say the B word? I can't.
It's extremely powerful. It's the thing that holds the entire universe together, and I don't know why anybody over the age of 65 thinks that they're going to do it.
You're not going to win
by holding onto a grab bar in a slippery shower.
So I want to talk about grab bars too.
I don't.
You don't want to?
I don't
just
like
shower
them.
chairs.
I don't like grab bars. Grab bars are a terrible return on investment. A grab bar is only as good as your arms are long and as good as your hands are strong, right?
Ooh.
It's like a false sense of confidence.
It is.
Turn that mic on and ask the question.
So think about this. If I had you standing on a skateboard holding onto a grab bar with your arms out like this, and that skateboard goes out from underneath you, where are you going to end up?
Smack in your face.
Right.
This guy and his metaphors,
The only way that you're going to be able to resist gravity is if you're pushing down on that grab bar. Well, conveniently, Medicare pays for a thing that people can push down on to hold themselves up. It's called a walker. It's called a cane. It's a portable grab bar. It's a portable grab bar. So instead of installing a stationary grab bar on a wall that somebody has to rely on to provide their balance, why don't we just teach them how to use their ambulatory device to get all the way into the shower or all the way into the tub?
I lived in your world for a while in a couple of different capacities. I never thought about that.
And it all started. Dude, it all started when I walked into a patient's. I walked into a patient's house and she had 7 grab bars in her bathroom. They were like damn rings on a tree. All right. She got the first one when she was in her 40s because she wanted her Calgon moment, right?
Yeah.
She got the next one when she was in her 50s because she had a bum knee. She got the next one in her 60s because she had that knee replaced. She got the next one in her 70s because she had the hip replaced. And every time somebody would come out, they were charging her $250 to drill holes in her tiles and put another grab bar in an indiscriminate position. An average tub is 34 inches deep. If you put a grab bar on the back wall, we're asking these older people to lean over the tub to grab a hold of that grab bar. Or they want to put in a vertical grab bar, which is just a fire pole for an elderly person.
Oh, man. Another metaphor, right? Trey's over there laughing in the corner.
Yeah.
Back to
how I get paid.
You don't. I mean, again, no. This is great.
No.
You're insured. You get compensated by everyone except for Medicaid.
Everybody except for Medicaid.
Private pay. Dang it, dude! I'm looking at the time just ticking down.
And if they don't qualify medically, okay. So somebody calls me. They're 65. They're on Medicare. They've never fallen. They're worried about going on a cruise, but they're also worried about when they come home from the cruise, making sure that their home is safe. It is not medically necessary that we prevent falls in their home, so therefore I cannot bill insurance. But a private pay assessment with me, the most I charge is $1,000. And in that case, I take all the measurements and provide a report to the patient that they can give to any contractor so that the contractor can understand clinically what needs to be done to that home. Contractors are really good at putting in tiles, but they don't know how to make the space safe for somebody who's a fall risk.
Contractors who do that specifically. I can't remember. Again, I've been out of that world for a while. What do you do? So what about supplies? A patient or their family's like, I need X, Y, Z. And I love, look, Amazon's great. What about local DME companies?
I don't typically deal with local DME companies because the problem is that the way that they make money is they price their stuff so that they get reimbursed by Medicare. And what you cannot do is you can't sell somebody something for cash and charge a different price for the insurance.
Okay, that's how, again, a lot of things in insurance work that way.
You were talking about my quote, a $10,000 problem with a $100 fix, right? The number one problem I run into is people want to rip their tub out and they want to do a walk-in shower or something like that. When I made that quote up, that was years ago, and that's when a walk-in shower cost about $10,000. They neglected to realize that a $55 chair that sits over the edge of the tub would make it so that they could still shower themselves. A $10 shower head that you take off and you hold in your hand, $65, we just solved the problem of somebody showering themselves. Now, if you want to be bougie and shower yourself in a fancy shower, that's fine. You're going to spend a boatload of money to make something safe when really you're only in there for 15 minutes. And all you're doing is washing your butt. Right?
Yeah, I mean, pretty much. Here's a random question. Like, there's a lot of males in here. Have you seen those things? Like, do you just wash your head, armpits, and privates? We're going way off topic.
I wash everything.
You do?
Yeah.
I mean, again, do you actually reach down and wash your feet with soap and water? Or you just let the water?
I don't wash my back. I'll tell you that. I don't wash my back.
Dude, sorry, that was just
my back has never been as dirty as some of my patients claim their back is because they need a caregiver to wash their back for them.
How much time we got left?
3 minutes. 3 minutes.
Okay. This guy, social media, by the way, I didn't know. Yeah. I'm not a social media person. I like LinkedIn.
I'm learning.
The website, I'm going to say Call Before Mom Falls. I love that .com.
Callbeforemomfalls.com.
That's great. The actual website is also the full business name.
So the business is modified. The business website is modified-independence, DENCE. But you can literally type in callbeforemomfalls.com and it'll take you right to my website.
I love that tagline.
If you don't remember mom, I also have callbeforedadfalls.com.
What's the Instagram? Is it just your?
It's just me, Wilson KEOT. My personal Instagram, my business Instagram is Modified Independence.
The videos that I saw, I think, are hysterical.
So you probably follow me personally.
The personal one.
Yeah, a lot of people don't laugh about falls with seniors there, Eric.
Well, we do. Like, a lot of people don't laugh at a lot of things I say, but I enjoy it. So.
But on my personal Instagram, yes, I have a lot of fun. But usually my professional Instagram is more about, business.
All right, we got 60 seconds here left. Anyone else you want to say hi to? Website one more time.
The website is www.callbeforemomfalls. I want to say hi and thank you to my lovely and beautiful wife, Carrie, because without you doing makeup on Eric's lovely and beautiful wife, he and I wouldn't have met, and we wouldn't be here today.
My wife has never listened to this show. She won't listen to this one either, but Carrie, nice to meet you. Thanks for doing all this makeup.
My wife's not going to listen to this show either.
I knew it would fly by. Kris Wilson. I love saying this. Certified Environmental Access Consultants. That's a lot of terms.
Yep. But the only thing you need to remember is callbeforemomfalls.com, because
that is
all
what the
falls
health,
are preventable.
That's it. All falls are preventable. And that is what the health just happened.